Hi, I'm Sarah from Rose Physical Therapy, and in this video we're going to talk about a few concepts to help improve your running economy. So through the course of this video we're going to show you some exercises to get you the mobility you need for a good running form, show you some stability exercises to improve your running mechanics, and also just go over some concepts and common mistakes. So hope you enjoy it. So we're going to go through a few stretches to help you get the mobility you need at those joints, and then we're also going to show you a few exercises so you can have stability and proper form while running. So the first joint that we're going to talk about that a lot of people might have issues with is your great toe. So one way to stretch your great toe is you can just kind of do it yourself using your fingers. You can just kind of get a good stretch. You need about 50 to 70 degrees of extension in order to have a good push off when you're running. And another way you can get that stretch is we can come over here in mountain climber position, and you can get a good mobilization of that joint by bringing one leg forward and rocking off of your toe. So your toe should be planted and you should be trying to gain a little bit more range at your great toe joint. Okay, good. And another joint that's often limited is dorsiflexion, or bringing your toe up towards the ceiling. So one way we can stretch that would just be just kind of doing it like this and holding it up like that, but because you also need closed chain dorsiflexion, we can also, if you come up against an object, go over to this tree over here, you can lean up against the tree, bring one leg back, the leg that you need to stretch, and keep it straight, hold for 30 seconds, and also, since there's two joints going across the two different calf muscles, one of them crosses the knee, one doesn't. You also need to bend the knee to take out the gastroc and just stretch the soleus muscle. So those are things you should be doing. All of these stretches are mostly 3 sets of 30 seconds. And we'll move on to the knee joint. During running, you need 70 to 90 degrees of knee flexion. So basic way to stretch your quadricep muscle is just kind of grabbing your foot like this and getting good stretch through your quad. Also, a lot of runners lack hip extension, so bringing your leg back like this. So you can also kind of get 2-in-1 the quadricep and your hip flexors by trying to bring your hip backwards while you're getting that quad stretch. So this kind of stretches out the hip flexors too, as long as you're not leaning too far forward with your torso. Alright, so in our next section we're going to talk about a few things that you need to have good stability and strength while running. Okay.
Alright, so in this next segment we're going to talk about stability needs for your running. So we're going to use Sarah as an example here. We're going to start kind of more proximal and then work distally out down to the foot. So the first thing that we kind of think about is the core with running form. So a lot of runners have kind of like what we call an anterior pelvic tilt, and they're kind of slanted forward because they have tight hip flexors from running a lot, or sitting on the couch all winter, either one. So in any case, we want to practice kind of posteriorly pelvic tilting, getting that pelvis back and engaging that core musculature there. So Sarah's going to practice a couple of those, and that's a really good cue to use when you're running to kind of hold your core in tight. That's going to help keep your feet underneath you and have a better stride length, which we'll talk about more later. But just this is a good cue to start before you start running, and then you can practice holds and start engaging some core there. Working further down the body next, we're going to look at glutes. So a major muscle that plays a big role in controlling your lower limbs. A lot of runners have weak glutes, and that causes all kinds of problems when you get those knees coming in. You have ITB problems, you have patellofemoral problems and foot problems, all kinds of things. A lot of it stems from the glutes. It's really the powerhouse of the lower extremity. So we're going to do just a good basic squat here with Sarah. So things that we look for are keeping the knees behind the toes is always like number one. You want to have a nice, decently wide stance here. And then it's going to be pushing the hips back as you come down and squat. So I'll put my hands here. And so you can see Sarah does a really good job of coming back, keeping the tibia relatively stable, and really engaging her glutes. So when you come down, you want to think about squeezing your butt, not using your quads. Everyone's really quad dominant. You want to use a lot more glutes. And if you want to come over here, you can look around the front. And another thing we like to look for is adduction of both of your knees. So a lot of runners will come in as they come down, and that shows a weakness of that gluteus medius muscle. And that's something that you definitely have to work on. If you're doing it during a squat, you're going to be doing it during your running, and that's going to cause all kinds of torsion to the knee and problems there too. So it's a good preventative strategy. Just get a good squat in. You can use it as a cue up before you run to get things really firing. Going down a few more that we can use just for foot stabilizers are really important. You know, ankle problems, toe problems, plantar fasciitis, Achilles tendonitis, all that kind of thing. If you don't have proper stability, mechanics throughout your lower limb, it's not gonna work out well for you. So we're gonna go with just a basic heel walk. It's a really simple exercise. Just walking on your heels. You can use it before or after. It's a good strengthener to kind of, you know, tighten up all those slack muscles and tendons. If you haven't been running in a while, you can walk around. Usually people like to walk around like on some soft grass or something. You can do about 100 meters. You know what I mean? Back and forth as much as you can handle, really. Start loading those muscles before you start working them a lot. You know, start running really intensely. You can also do toe walks for your calves, obviously. A little bit for your posterior tib here. So you're getting a lot more in there. It's more than just a regular calf raise. And it's stability through the motion, so it's functional with your gait. And then the last one we'll go here with this is walking on the outsides of your feet. So this is a really good one for the arch of the foot, which a lot of people have fallen arches. That's working that posterior tibialis muscle, and that one helps keep that navicular up, helps keep that arch up, and helps you have a really nice strong foot throughout your gait cycle. One last one we're going to go over is for shin splints, a really common injury from too much too fast. So I like this one kind of before you start really running a lot and putting on the mileage and all that. So what we're going to do is Sarah's already pulling her toes towards her shin here, and I'm going to pull away from her shin, and she's going to resist me. She's trying to keep it towards her. I'm trying to pull her away. She's going to let me slowly pull down, and I'm going to win eventually, right? And then she pulls it back, and then I keep going like this. So what that's doing is that's called an eccentric contraction, and that's lengthening and strengthening that muscle in a functional way that you'll use if you're heel striking throughout your gait cycle, which most runners do. So that's a really kind of neat trick to start doing, to start loading your feet before you start putting all your body weight on it and putting too much load on it and then injure yourself. So those are kind of the things we're going to use for mobility for spring training.
Another mistake people make is not keeping their upper body relaxed enough while they run. You want to keep your elbows at 90, and you want to try to avoid them straightening out as you swing them back. A good thing to do is when you're running a race is every mile marker, you can raise your shoulders at your ears and then just kind of let your arms relax. This is just teaching your body to stay relaxed and in proper alignment. Another thing you can do is when people run, they tend to rotate and use the momentum of their arms. So what you can do to train your body to run forward is it's called a hands to head drill. What you're going to do, you're going to put your hands on your head, and then you're going to run. You're going to engage the core. This is teaching your body to stay vertical and not do that rotational side-to-side movement. Another common mistake that people make while running is not having enough ankle mobility. I know we touched on this before, but ankle mobility is important because you want to have a forward lean while you run, because this is going to allow you to move forward and not waste energy on a vertical mile. You want to make sure you don't bounce when you run. This wastes energy. We want to make sure that we keep our head level, and we want to lean a little bit forward. Another common mistake people make while running is not running fast enough. A lot of people just think that they can work their way up to running fast. Well, if you don't train your body that way, it's never going to get there. So right away from when you begin running, you want to start off with doing interval training and incorporating bursts of speed in with your normal comfortable pace. That's going to allow you to start running faster and be more efficient.
All right, that's it from us. Sarah, Sabrina and Mike at Rose PT. Thanks for watching.
Bye-bye.
Bye.
Happy running.
Happy running.